Thanks for coming, Lindsay.
You bet.
There's some defining moments in life, and I think one of those was when I first got the call about you. I hadn't been in practice for like a super long time. What was the date of the?
It was August 31st of 2019.
2019. So I had been in practice for maybe 4 years or so.
Well, I'll have to tell you something. My mom, when she saw you, she was like, where's the real doctor?
Yeah, I know.
This
I still
guy
get
is
that.
so young.
You were in your 30s.
Yeah.
Early 30s.
35?
Yeah. You were with your daughter.
Son.
And son. Or just your son?
Just my son.
Just your son. Okay. Yeah. And you knew something was wrong, and I think you called your mom. Is that right?
Yes, because I live kind of in a really rural area, like in the middle of a field. Mm-hmm. So I knew from this headache that I had that I wouldn't be able to tell 911 how to get to me. My mom, she's a school teacher there in Mount Pleasant, and I knew I could get a hold of her. Mm-hmm. So I called her. She kept hanging up on me because she was in the middle of teaching a class, and finally by like the fourth call she answered, and all I could say before I collapsed was, I've got the world's worst headache. I need you to come take me to the hospital.
That was probably the best thing you could have said.
Yeah.
So you were taken to the hospital.
Mm-hmm.
And do you remember anything?
I remember hearing things.
Mm-hmm.
I couldn't see because I was like in a coma, but
they did a CT scan, and they noted that so there's a fluid space inside of the brain called the ventricle. It's filled with spinal fluid, and yours was filled with blood. The whole thing was filled with blood, and there was some bleeding also into the brain. I saw that scan before you were flown in. They said that you were on your way, and I looked at that scan, and in the back of my mind was one of my attendings from residency that used to say, when that situation occurs, the mortality is 100%. Most patients pass away. Now, granted, most of the patients that present with that are in their 70s and 80s, so they don't have the same ability to recover. And then I was in my office, and I heard the helicopter landing, and I thought, okay, she's here. We got to do something. Came in and saw you, and I remember walking from my office over to the emergency room, and neurosurgeons are faced with events and moments that they don't really have a lot of control over, but they're dire, and so like the tendency is to try to control the circumstances and to lash out a little bit. And I guess I just thought, well, what could be done? And I just felt this like very distinct stillness, this peace. I thought to a national conference that we had been to. At the conference, there's like all of these vendor tables, and one of the vendors was showing a retractor that you can put into the brain, similar to the retractors we put in the back for minimally invasive spine. And I recalled just our brief conversation, and I thought, we should do that. We got the additional scans, and you've learned a lot about Moyamoya syndrome. It's not very common, and we've realized it was probably bleeding from Moyamoya. We've got the airway controlled. We can control blood pressure. Let's ship this stuff in. I called the rep. We shipped it in overnight. Give it another 12 hours because we're not going to be able to stop bleeding. There's no way to go in and coagulate blood vessels because these are in the blood vessels from the thalamus and the brainstem and areas you can't just go in and burn, but we needed to evacuate the clot. So that was the plan. And I actually felt like really a lot of peace about it. Next day we go in, put the little tube in. It was like unreal how much blood came out and how much pressure it was under. And it just all came out and no bleeding. And the plan sort of worked. So that's kind of my little backstory on my experience with it. Tell us a little bit about what happened as you were in your recovery. Like what's the next things you start to remember?
Okay, so I actually remember you talking to, it would have been my mom and my husband, and asking them questions, this was probably before you realized it was Moyamoya. I specifically remember you asking if it was drug related. Mm-hmm. Like you see this kind of bleed in people who use cocaine.
You do. Uh-huh.
And I remember thinking, these people are going to think I'm a druggie. I've never used drugs in my life.
Yeah.
And how am I going to tell them that I don't? Because I was in a coma.
Yeah. That's always kind of a sensitive thing because we don't assume, but we also don't assume that it's not.
Right.
Or we need to make sure.
Exactly.
Yeah.
I remember hearing lots of voices, like people, some I recognized, some I didn't.
Mm-hmm.
I don't really, because I was so like able to hear, I don't really have a pinpoint of like when I woke up because I could hear so much going on.
Mm-hmm.
But once I woke up, oh boy, the work started. Instantly that same day moved me up to the therapy floor.
I forget how many days you were in the ICU, but it was a few days.
Yeah.
You were a lot better right after surgery, so that taking the pressure off, I think, was helpful. There was still a little bit of blood left that resolved on the scans. The recovery process, though, was hard.
It was so hard.
Long. Tell us a little bit more about your rehab and the things that you went through.
Okay, so you think when you first wake up from this coma, you can rest a little bit. No, you can't. My day would start, I want to say, I think 6 in the morning, 6:30. And I would do occupational therapy. The occupational therapist would come in and they would help me shower, help me get dressed, help me brush my teeth, whatever I needed help with. From there, I would do physical therapy, trying to, get my balance back. There was like several rounds of all of these different things I was doing.
I remember seeing you with your kids in the hospital, and that always makes it more almost emotional, right? Because it's like, this isn't just a woman that has a bad problem. This is a woman and her kids and her family and her husband and mother and other friends and relatives that care. And it's like the stakes are high,
Yeah.
Every time that an injured patient or a patient that's had a bad problem, and then they've got their little kids around them that need their mom.
Need their mom. Yeah.
As I've reflected on your experience, I think that concept of being still, the anxiety is hard.
Yeah.
When you're really anxious or you're scared, it's hard to think. And you've got this situation where it's a lengthy recovery. Even though you recovered really fast, it's still arduous and long. And despite a lengthy recovery, it's to still be in the moment. Just that concept of staying in the moment is really important.
And you did a great job. Like, I'm here because you kept a cool head and
I don't always do that. You got lucky. But it's one of those things where I come back to that moment. The stakes were high and things were at risk, and the reaction is to just panic or to tighten up a little bit. My kids play tennis, and if they lose the first set and win the second, they're very likely to win the third, because the first set loser tightens up in the third. And if you're tight and you're stressed, you don't perform as well. And so maybe your mother, when she picked up the phone and realized what was going on, probably had a similar thing, like, yes, we need to act right away. I need to drop whatever I'm doing.
She did. She literally walked out on her 5th grade class and motioned at the office, I'm leaving, family emergency. And
which was exactly what she should do.
And got right to me. So,
well, we're grateful that you're willing to share your story. It's a wonderful story. We're grateful you're still around.
I am too.
Yeah.
So thank you.
Yeah.